Hi, Avada Babes. This is your nurse V coming at you once again. I am, like I stated, I'm going to be consistent in trying to continue to post these videos as we come from, Hi everyone, this is your nurse V. I want to wish you guys a Merry Christmas and Happy New Year if I don't talk to you prior. I'm just going to go ahead and continue on our series of education because I want you ladies to understand what you need to do. Post-surgery, pre-surgery, all of during, really pre and post-surgery because you can't do that during surgery. That's all the doctor's job. So once again, my name is Nurse V and I am here at Ivana Wellness Spa and Recovery where you guys can come and get services. But right now I'm waiting on a client, so I said, let me just go ahead and post this video. So today's topic is going to be about medications, okay? Medications. So number one, let's get right into it. Do not take your medications on an empty stomach. We've all known this for years and years and years and years. You take medication on an empty stomach, you're going to feel very, very nauseous and other effects depending on the type of medication it is. So after surgery, prior to surgery, anything, prior to surgery, don't take nothing unless your doctor told you to take it. That's one. But definitely, after surgery, do not take anything on an empty stomach. If you have to have like soup, crackers, a light drink, a smoothie, something like that that can assist you in coating your stomach so that you don't have the extra issues of nausea, vomiting. And then if you throw it up, like now you don't waste a whole medication pill, either Percocet, stuff like that. So let's not do that. Do not take any aspirin medication. Usually, you don't want to take any aspirin. Aspirin is an anticoagulant, which is kind of like a heparin, and it's a blood thinner. So you don't want to thin your blood because you just had surgery, okay? And you're already bleeding actively, so we don't want to increase that bleeding, okay? That's the explanation by do not take any aspirins, okay? Prior to surgery, do not take any blood thinners unless your doctor tells you to, but usually they're not going to tell you to do any of that. So if you're taking like aspirin, heparins, any anticoagulant medications, do not take it and or communicate with your doctor and let your doctor know, hey, this is what I am on. Can I still take this? And if I can take it, how long can I take it for up until prior to surgery? Usually prior to surgery, those type of medications is like a week to 2 weeks, but that you cannot take those medications prior to surgery because of course, like if you're having surgery and those are blood thinners, they cut you open, you're gonna bleed and they can't stop it. So communicate with your doctor, find out what the plan is, let them know, be honest ladies with your medication history, and go via the doctor's order, okay? For breakthrough pain, you can do Tylenol. Some people do Motrin. Some people obviously have the main medications, which are the Percocet, the Oxys, and stuff like that. So you just kind of have to see whatever your doctor gives you and recommends for you. Some people, honestly, they have the CBD products too to assist them, like the little gummies and stuff. CBD, not THC, CBD. But once again, it's all about talking to your doctor and seeing what they do recommend, okay? So, and breakthrough pain is not necessarily like your main heavy hitters, which is your narcotics, like your hydrocodone, which is Percocet, Oxys, and all that stuff. Those are actually narcotic medications. For breakthrough pain, it's usually like the lesser hits, like the Tylenol. So usually how it works is you take your narcotic for the 4 to 6 hours that is recommended per prescribed. And then, maybe in your last 2 hours or your last hour, you can do like a Tylenol. And then you go back into your actual narcotic, if that is how the doctor wants you to do it. But usually that's how it goes. Breakthrough, middle, okay? Narcotic, breakthrough, which is Tylenol, and then narcotic again per prescription, 4 to 8 hours, depending on the strength of the drug, okay? And then you can consistently do that rotation until you get better. And then, honestly, like for me, myself, I knew, like I was scared to get hooked on narcotics. Some people do. So I was like, okay, I'm going to take my Percocet. And then maybe the next day I took just Tylenol. It just all depends on you and your personal pain control. Okay, everybody has a different pain tolerance. Okay, do not exceed anything over 4,000 milligrams of Tylenol. Take everything per prescribed, but moderately. Okay, do not do that, and do not overtake your narcotics, ladies. I know you're in pain. You have to break through that pain and mentally think, I'm okay, I'm okay. Next, after 2 weeks from surgery, you may potentially, depending on your doctor's order, be able to start up all your prior meds, such as whatever you were on. But you have to communicate that with your doctor, okay? Do not take any herbal supplements and or over-the-counter medications 2 weeks prior to surgery. That's just period. There are a lot of medications that are blood thinners that we potentially do not know about, okay? So, like, do not take certain ones. At this moment in time, I'm having a moment, but there are certain medications that are blood thinners that are herbs. Do not take it before, do not take it after. If you are on a herbal medication or you're just doing it for yourself, because it's not prescribed, herbs are usually never prescribed. It's something that, you know, herbalists do, or someone who said, hey, this works for me. Let your doctor know. Communicating with your doctor and being honest with your doctor about everything that you're doing in your life could potentially save your life. So make sure you're upfront and honest. Don't be afraid and be like, oh, well, he's not going to give me my surgery. Oh my God, he's not going to give me my surgery. And that might be true, but what is worth it? The surgery or you breathing? Okay? You surgery or you returning home to your kids? I'm going to be real honest with you guys. I'm going to be very open, honest, and blunt. And so with that being said, do not do that. You can do like arnica gels and pills and stuff like that, lymphatic drops, and all those things. The arnica is for you to assist with bruising and swelling. The lymphatic drops helps with shifting of the fluid and getting that fluid out. So you can do things like that. It is recommended that you do take multivitamins and iron supplements prior to surgery and after surgery. Prior to surgery because, you know, let's make sure your blood levels are accurate. Let's make sure your iron levels are good, because iron, hemoglobin, oxygen, all that kind of ties in one. And if you don't have a certain type of level of iron, oxygen, hemoglobin, hematocrit levels, they're not going to do your surgery. So ensure that you're taking those supplements prior to surgery, so that when you do your labs, the labs will show that you're perfectly fine and you're not anemic, which is pretty much like you have no blood. Like, that's how I see it. Or you just have low levels. Like, usually anemic people are cold, or they like to eat ice. So try to ensure that you're taking those supplements pre. And then post-surgery, because you have lost the blood that you obviously need in our body to be able to sustain life. So let's ensure that we have our supplements and multivitamins post-surgery as well, because we just went under a traumatic experience, okay? So let's go ahead and that is pretty much a summary for the medications. I want everybody to enjoy their new year. It is about time. My client is about to come in. She is getting some wood therapy done today. We had yesterday's session and we're having a today session. So I want you ladies to have an amazing day. Like I said, if I don't see you guys prior to the new year, I want you guys to have an amazing new year. But ladies, let's be honest. Let's make sure we do what we need to do immediately after surgery, prior to surgery, and let's make sure we have the proper medications, okay? Ask your doctor. Always talk to your doctor and be honest. I also will list those herbal blood thinner medications in the description below, okay?